quote, emergency justification for bypassing notice and comment requirements. Finally, the court agreed that we were likely to succeed in establishing that the CMS vaccine mandate is arbitrary and capricious because there is a lack of evidence showing that that vaccination status has a direct impact on spreading COVID in healthcare facilities, among other things. And the court noted that the mandate will cause a loss of staffing in many instances that would result in, and I quote, no care at all, as some facilities will be forced to close altogether, end quote. Now, I'm sure that to people who've never driven the roads or highways of rural America and across this state, or actually talked to real people affected by bureaucratic overreach, the real healthcare workers, the real patients, the real hardworking Americans who just want to live their lives without government overreach, these mandates sound like a good idea. But here in flyover country, we've had enough. And we're going to fight back every single time they try to take our freedoms away. We're going to continue to fight to halt OSHA's vaccine mandate on private employers. We're going to continue to fight the vaccine mandate on federal contractors. Because here's news for the Biden administration. I have talked to the real people here in Missouri, not just healthcare workers, not just small businesses who are struggling to find employees to make a living for their families, but everyday citizens as well, moms and dads, families who believe that they can actually make these decisions themselves and they don't need the government to dictate those decisions to them. This is America, the greatest country in the history of the world, and as your Attorney General in the free state of Missouri, I'm going to continue to fight for individual rights of the people of this state, and with that I'd be happy to answer any questions.
You mentioned that the state indicates the court thinks you're likely to succeed in the bigger case. Are the walls of Jericho tumbling down?
No, this is a significant ruling and the first of its kind in the country. And so what the court said today was that CMS, the Biden administration, has no authority. There's no statutory authority for them to do this, none whatsoever. And more than that, the process by which they went about doing this violated any notice and comment requirements that they're supposed to have. And so the court ruled that we're likely to succeed on the merits. I would expect the Department of Justice to appeal. I would expect this to go all the way to the Supreme Court. But the fact is we won. And we've halted this mandate, which I think if you talk to the men and women in the healthcare field, who, by the way, a year ago were being honored as heroes and are threatened to be put now on the unemployment line, they welcome this news.
And what is the impact, of course, for Missouri healthcare workers, but also across the country?
It's significant. This mandate, which was a clear overreach, the federal government has no authority to do this at all. This is a victory for them. They can make these healthcare decisions themselves. This is about individual freedom. This is about individual rights. And we've succeeded in persuading the court that this mandate violated all of those tenets.
I mean, does this mean all the other states who are parties to the suit that it's state, they are also...
That's correct. That's correct. Yep.
Can you speak to some of the concerns that people now have with this new variant coming into the discussion? People might be on the opposite end of today's announcement, wondering, well, what does this mean for the safety of Missouri residents if there isn't a federal mandate in place?
Yeah, I think, look, we should be continuing to want to know more about any variant. And the truth is, COVID's with us. There's always going to be a new variant. But I think people have had enough of the government locking people down. They've had enough of the government instituting mask mandates. They've had enough of the government instituting vaccine requirements. And so every time there's an overreach, we're going to push back. And I think today's evidence that we're going to win those fights because thankfully we live in a country where the law still matters and the Constitution still matters.
Can you speak to the recent mask mandate suit that was filed and the county, St. Louis County's response to it as of late? I know that there's another lawsuit happening right now, but can you kind of speak to the county executive Sam Payne's response to him saying, you know, that this is kind of an overreach, that they're not getting an opportunity to make local decisions on mask policy?
Well, Sam Page has been wrong about this from the very beginning, quite frankly. He continues to lose in court. We'll be in court again tomorrow with their new health order, which is an illegal order. They're not allowed to issue an order 6 months after one has been terminated or expired. That's what we're arguing about tomorrow. But obviously the ruling from Cole County is significant. And what that ruling says is that these local bureaucrats, health bureaucrats, have no authority to issue these kinds of orders. And so, you know, that the judge has made a sound ruling, and we will be enforcing that ruling across the state. Other questions? Okay? Good? Thanks, guys. Hopefully the sound quality is okay. Bill, how are you? The Hall of Famer. Good job. Thanks. Good to see you. All right, we'll see you guys.
So, hospitals already require vaccines, you know, for other, you know, types of transmissible illnesses. Why is this one different?
Well, I think this is about what the role is of the federal government. The federal government has the authority under its own policy to require vaccines. So this issue is about the federal government. I think that these cases make this
Fell off a while back. I just need to put it back on. See, that's it. See, there you go.
Do you foresee, you know, rulings on this bleed over into, you know, employers requiring other types of vaccines or things of that nature?
Well, the employer